Today, we're diving into a topic that touches the lives of millions of women, menopause. We're fortunate to have three incredibly knowledgeable women with us, each bringing a unique perspective to this important conversation. Together, they'll shed light on the realities of menopause, debunk myths, and offer guidance for navigating this significant life stage. Katherine Ambrose, with her decades of experience empowering seniors, understands the holistic impact of life transition. Dr. RHEA ROGERS, a board-certified OBGYN, brings her expertise in hormonal health and wellness, offering valuable medical insights. And MELANIE HALL, a nurse practitioner specializing in hormone optimization, provides a practical, patient-focused approach to managing menopause symptoms. Thank you, ladies, so much for being with us today. Such an important topic. I think the very first thing that we want to talk about is menopause and perimenopause. So, Dr. RHEA, we'll start with you. What is menopause?
Well, the classic textbook definition is the loss of hormones with no cycles for 1 year or more. However, if you've had a hysterectomy but you still have your ovaries, you can confirm that with labs. And so sometimes maybe you won't have a cycle for 3 or 4 months. You haven't met the criteria, but the labs will show you're probably not going to have another cycle and that you have hit that period. Understanding that it is the decline or the absence of the hormones, but the decline starts way before that and is typically just perimenopausal.
And that's when you'll start seeing what? Hot
flashes? Many people will have still symptoms. You know, people will have different areas of symptoms, would you say? Mm-hmm. And I tend to tell them it depends on how in tune they are with their body. So maybe someone will have hot flashes, night sweats, and they're not menopausal, but they have a drop in one of their other hormones, or maybe they don't feel anything and don't realize that the decline of their hormones are going to be detrimental to their aging. So everybody experiences different things. I think we're used to the traditional symptoms of hot flashes, mood swings, night sweats, vaginal dryness, pain with intercourse, decreased libido, even changes in the hair and skin and joint pains. But everybody's experience is going to be different.
Yeah, and Melanie, for you, you learned and trained into this whole thing. Kind of describe what you see with menopause and describe the difference between perimenopause and menopause.
Menopause is basically 1 day. It is the day that you haven't had your period for a year. Everything after that is post-menopause. Perimenopause is leading up to that, where things start to change. Your periods either get longer apart or start to become irregular. I know that I felt symptoms in my late 30s. I didn't realize that it was perimenopause. I just thought I couldn't sleep. You know, I would wake up at 3 o'clock in the morning, wide awake, didn't know what to do, read a book. 6 a.m. I'm ready to go back to bed, but guess what? It's time to get up and start your day. It didn't matter how little sleep or how much sleep I got, it was always 3 a.m. I woke up every morning. That was one of my first signs. And if I was experiencing that in my late 30s, as I got into my 40s, then I started having the night sweats and more classic stuff. And I'm like, but we're just told that, that's a normal part of aging. And we just feel like, why complain about it because this is normal? And so we need to break that taboo, and it's not normal. And we don't have to suffer anymore. And women have been suffering in silence too long. So if you feel like you're having some kind of issues, something's just not right, you just feel off, you need to go to someone who understands and can check you for these things. Many physicians won't do the labs for hormones. So you need to go to an expert who will do your labs, see where you're at in your life cycle, and maybe you are perimenopausal, and we can fix you up with just a little bit now so that you don't have to continue going down this path and suffering from these changes as they come along.
Yeah, and I think too, a lot of times we're just miserable, and I don't know if you want to talk about this now, but the whole hormone replacement therapy, a lot of times people are afraid of it. I was afraid of it because I have a history of breast cancer, and I know, Dr. RHEA, you do as well. So talk a little bit about what you can do to help with these symptoms and when you should go see a doctor.
Well, what you can do, first of all, the myth came from the WHI study. When those results came out in 2002, they scared everyone. And what people don't understand is the replacement of hormones should be with bioidentical hormones. It doesn't mean, it's not the source they came from, it is the actual chemical. So basically it is the blueprint of what your body's already making. That's not foreign to your body. And with the WHI study, you have to understand the flaws and what they used. And so they used Premarin, which is estrogen, and that's not estradiol. They behave differently. What they use is the urine from horses, you know, and it's 40% estrone, it's 15% beta estradiol, and then everything else is equilin, equilinin, and other horse estrogens, which that's not us. So by doing that, that added a lot of synthetics, and that's where you got the side effects. So when you talk about the risk of heart attacks and stroke and blood clots, it is the estrogen and those synthetics. They increase a protein, MMP9 protein, and that causes lots of blood clots and everything else. So that was the side effects. And in terms of the breast cancer, that's the progestin, not progesterone. But they confuse people because they say, oh, it's a generic progesterone, it's medroxyprogesterone, it's Provera, it's norethindrone. No, they're totally different. They change the side chains, it makes it synthetic, and that's what was causing and contributing to the breast cancer. Not my opinion, that's what the studies started to show, so that progesterone is very protective against breast cancer. Progestin caused it.
Right, and we had talked about this previously, about the importance of hormones in our bodies to help us continue with an active life and to feel good. Melanie, talk a little bit about why it's so important to keep those, because a lot of women, like we talked about, are afraid of the hormone replacement therapy because they think they'll cause side effects, they'll cause diseases, but in fact, it's the opposite.
Yeah, it has been shown that 17-beta estradiol, which is the bioidentical, is actually protective of our bodies. It protects us from breast cancer, it protects us from colon cancer, it protects our brain from dementia, it protects our heart from cardiovascular disease, and our bones from osteoporosis. So it's very good to have on board long term. But there's been so much taboo since this study because everything was put out as hormones are bad, hormones did this, hormones did that, but they didn't talk about what specific hormones caused everything. And yes, a lot of it was the progestins, which is not natural. So giving you the bioidentical, which like Dr. Rogers said, it is exactly the key that goes into the lock that you have in your body and is identical to what your body naturally makes. So all we're doing is replacing what your body is lacking at this stage to help you live a long, full life.
Yeah, and Catherine, for you, I know you look at seniors and how we can continue to live. What have you seen with women who have not had the replacement therapy compared to women who have?
I've witnessed people age backwards with the right kind of treatment. And so this is a very youthful topic for me because I'm normally talking about people that are in their 70s, 80s, and older. So I was so excited to be part of this because I see Dr. Rogers, and now I have my husband going to her and my mother, and it's making a huge difference for all of us. And if I had not been studying these aging topics, I don't think I would have checked into it. I probably would have just listened to the idea that you just suffer through it and there's nothing that can be done. Or just being confused about, should I be on hormone replacement therapy or not? And so I would say you've got to ask questions, be curious, and be resourceful because it's made an extraordinary difference in my life. And we're bringing people in their 80s to Dr. Rogers all the time. These hormones are really important.
And you said people are aging backwards, more energy. What are you seeing?
Absolutely. Well, and the crazy thing about this is when you're going through menopause, that is usually when a lot of other crazy stuff is happening, where you have adult children that you're helping, maybe you have grandchildren, and you may be guiding aging loved ones and having challenges with career and everything else, just balancing it all. And so I say, see a trained doctor that can make sure you are optimized, that you are as healthy as can be so you can deal with everything else you've got going on.
Oh yeah, and I know even for me, my kids one's moved to Florida, the other's in college. I'm having hot flashes, I can't sleep, and it just all adds up. And you just start thinking, is this my life for the rest of my life? And it sounds like it doesn't have to be.
To me, I'm probably happier than I've ever been. And I feel like I am the woman today that I kind of wanted to be 20 some years ago. But now I've gained this wisdom, and I'm being treated by the right physicians, and I feel like I'm on top of the world, and it really makes a huge difference.
Well,
I think we always look at hormones as feeling good. What people are missing is disease prevention and healthy aging. There's a huge disease prevention. Like Melanie said, the number one cause of women's death is heart after menopause, and there's a reason. But you can, even with high blood pressure, high cholesterol, all those different things, you can actually reverse those chronic diseases if you optimize hormones.
Interesting. So if you, for instance, have high cholesterol, will hormones help with that?
If you optimize them correctly, they will, and use the correct ones, you see. Because if you're on a statin, the statin comes with some collateral damage. It's going to decrease your testosterone by 50%. All right? So cardiac protection comes from testosterone. So I'm going to give you statin. I'm going to get this 2 to 3% protection against the heart, whereas my testosterone would have gave you 50% protection. And the new study, they just took off the black label off of testosterone that they had from that Travers study in the men. So they've taken all that out. Now you're supposed to just look for blood pressure. But, So
and I know you and I talked a little bit about this too, the cholesterol levels. Doctors say anything above 200 is you need to get on a statin. What do you think about that?
That's incorrect. So really, if you look at Dr. Goodenow, who looks at plasmalogens in the brain and the optimal levels, cholesterol are really 190 to 250. If you look at many of the studies that show when you start dropping the cholesterol, you start a higher morbidity. And all your cells are made out of cholesterol, the membranes and all that. So you don't want to drop them too low anyway. And then your hormones, they're made out of cholesterol. So you want to know if the cholesterol that you're creating is causing damage. That's what you want to know. Do I have plaque buildup? Am I going to rupture? You need to do the correct studies on that. Those are specialized cardiac studies. They're not very expensive, but it'll tell you, is your endothelial layer damaged? Where is your inflammation coming from? Because heart disease is not heart disease. It's coming from usually insulin resistance or chronic inflammation. So you have to find the source, but you have to do the right test.
Blood test.
Correct.
Right. Interesting. And as far as going to the right doctor, your OB, can the OB help you through all of this, or do we need to start going to specialized doctors?
It depends on what you're looking for. I was trained obstetrics and gynecology, but that's not what I do anymore. I don't do obstetrics, I don't do gynecology. I'm a cellular medicine optimization physician. Does functional medicine and goes back to where the cell went wrong. So wherever the cell went wrong, if I know the pathways, I can tell how to intervene. And you have to look at the body as a framework. There's multiple variables, but you have to hit all of them. So usually I start with hormones because it takes a while to optimize. But if they're stalling out on weight or anything else, I can use it. You have to hit gut. You have to get gut health, inflammation, stress, sleep. How are you, hormonal regulation in terms of what glucose metabolism. And really at the root of everything, if you start with cardiometabolic optimization, which your hormones are going to help you do, then you can get down to the metabolic dysregulation because that's what's really going on. And so it's chronic inflammation for all of these diseases. It's just how you manifest it. Did you get diabetes? I got breast cancer. Did you get fibromyalgia? Did you get dementia? It's all the same disease. And if you don't get to the cell and reverse it, it's just how you present it.
Interesting. Well, when we come back, we're going to talk a little bit more about how men face these same changes. We did a little bit, but we'll talk more about that. And we'll also talk about how society's changed a little bit. We're talking more about this, so stay with us. And welcome back. We are talking about menopause and life changes when we get to a certain age and how we don't have to deal with all of those hot flashes, mood swings, night sweats, just all the changes that we go through, because there is help for all of us. We talked a little bit about women and what we go through, but what about men? Melanie, let's start with you.
Okay. So a lot of men come to me like their wife has been optimized now and they're feeling great, and the men are like, I want to feel like her. So they come to me, and it's not just about libido. Yes, some testosterone is going to help with their libido, but it helps with energy. It helps with their stamina. So they get home, they have dinner, and they don't feel like they're going to fall asleep. They can get up and go mow the lawn that night. Helps with brain fog. They're able to perform better at work. And then they have a lot of long-term benefits as well.
Yeah, and Catherine, you have this example from your own home life. Talk a little bit about what you and your husband went through.
Well, I felt a little rooked by the time I got to have a relationship with Dr. Rogers, and then my husband did, in that, oh my gosh, if we would have understood this, he could have prevented some serious heart challenges. And so he's now seeing her to help with that. And I just think we don't know what we don't know, and this functional medicine is really important. And listening to her, I was just thinking that these hormones also give us a competitive advantage at work, too. You know,
the brain fog.
Yeah.
Yeah, focus.
And, you know, as we get older, we have to keep our edge. We have to keep our edge. You know, we have the wisdom and experience in our careers, but you want to keep your edge. And you don't want to get old and be tired and have the brain fog and be able to, you know, compete with the 40-year-olds.
And you feel like your husband may have not had heart issues had he gone earlier in life.
Absolutely. Absolutely.
And Dr. Rogers, you can talk a lot about this for men. And
a perfect example is my husband. My husband had thyroid issues, congestive heart failure, to the point where he couldn't even hardly walk. And between optimization of hormones and peptide therapy for the cardiometabolic optimization, people they're like, whoa, look at him, you know, the weight is down and all that. But it's just so much more to these hormones than, yes, we say you're using them to look good and feel good, but you want healthy aging.
How does it help with your heart, for example?
So the estradiol will help to decrease plaque. So that's the health benefit in women. If you get their levels optimal, then you will reverse plaque in the arteries. But it has to be oral. It has to be oral 17 beta. Everything else will help you feel good, but it won't reverse the plaque. So that's what you're after. You're after heart disease, you know. So just think about it. When your levels go down, and you're menopausal, and you don't make estradiol, what's the first thing that happens? Your waist, right? Well, there's a reason for that. That GLP-1 receptors, that the drugs that are agonists everybody likes, that receptor is in the intestine next to estradiol receptors. So you lose your estradiol, you lose your secretion of that. And then your waist gets big, and then you start the chronic inflammatory process. That inflammation everywhere. So you're building up plaque in your arteries, in your penis, because they're the smallest arteries, in your brain. That's dementia. You're doing all of these things at one time. So by making an impact on optimizing hormones to the level where they should be for reversal, you're hitting a lot of things later on.
And for men, we talked in the break a little bit about that, the men with the big, hard stomachs. This will help with that?
Definitely.
Absolutely. That's visceral fat. And again, visceral fat, that's chronic inflammation. Where's it coming from? It's hormonal. And you cannot reverse the hormones if you don't optimize. And then mainly it's insulin. It's the insulin resistance. Insulin is a bad player, the most inflammatory chemical in your body.
And we talked too a little bit about how people aren't talking about this. But I feel like it's become more common.
Absolutely.
You know, I know hormones have been around for ages, but it was the chemicals that were causing the problems. Now the studies have shown these more natural bioidentical hormones are what are okay for all of us. Why do you think people didn't talk about this?
Just being uncomfortable, and I just think the stigma of being an older woman, maybe being less desirable, less interesting. I just think
And seen as the normal part of aging.
Yep. Yeah.
We have the opportunity to stay really younger and more active longer thanks to modern science and the breakthroughs coming through. And like the GLP-1s, you hear a lot of discussion about that, pros and cons, but what you don't hear is that you also want to have hormones optimized to make the GLP-1s work better. And that we all need to be working on getting rid of visceral fat.
And we use the GLP-1s have so much other benefits that people do not understand. So the microdosing is great. We have people, not for weight loss, but for the anti-inflammatory component, the cardiac protection, and the neuroprotection. That's what they do. So you just, you know, ordering online and just whatever, you know, and they say, oh, you lose muscle or not. No, if you have it managed correctly, you know what you're doing with it. You just need to, don't just order online and think it's a magic bullet, I'm gonna lose weight and that's it. It's so much more. Many people stall. There's a reason you're stalling, you know? So the biggest thing is what happens as we age. We lose muscle, right?
Right.
So go back to all the disease states of loss of muscle, loss of blood perfusion and all that. And if you know what you're doing and why you're doing it, then you can treat it appropriately.
And bone density is
Yeah,
another.
definitely.
Yeah. If you lose
Osteoporosis.
muscle, you lose bone.
Yeah.
That's what people don't realize.
Yeah. And I think too, I remember even, I don't know, 5-10 years ago, women especially would be embarrassed if they were having a hot flash. They would just have a little fan on their desk and kind of hide it. But I feel like it's so much more open now. People are not afraid to carry that fan around and talk about it. Yeah, I haven't had a period in a year. I guess I'm in menopause. And I guess advice for women out there who may be watching who might think, okay, well, I'm only 40. Should I go? Should I have my hormones checked? And who will check them? Do you have to go to a special doctor like one of you?
I would.
I would.
Because if you go to your generalist or even the general OBGYN who's not trained in it, first of all, if you're having a cycle, you're not menopausal, unless it's a postmenopausal bleed, but then you've gone. But for most women, the other part that you have to get to, it doesn't matter how young you are, because now age, with obesity epidemic we have a lot of young girls with PCOS. That's insulin resistant. That's a hormonal hit.
What's PCOS?
PCOS is polycystic ovarian syndrome.
Oh.
And that is where you have insulin resistance that's creating havoc. Everybody with PCOS has insulin resistance. In a sense, they're pre-diabetic. But you have to find out what's driving their PCOS. So you have women, young ladies, who are 25. They don't look like the textbook picture of PCOS, but they have it, you see? So you have to find out what's the driving force with that. And so I find now the age that we're starting with these hormones, it's a lot younger. It's a lot younger. And the deficit is they have no progesterone, which that's why they're at an increased risk for uterine cancer and breast cancer. I mean, the body's smart. Like I tell Catherine and them, the only thing that's compartmentalized are the physicians. You have your cardiologist, your orthopedic surgeon, urologist. The body's not like that.
It's all one component. How busy are you, Melanie?
We're pretty busy. We're usually booked up for a week at a time. Usually takes a week or so to get into us. But just helping people is what we really strive for. So if it's something that you're looking into, I mean, we do free initial consultations. There is a charge for labs and stuff like that, but it costs nothing just to ask questions the first time. So I like to be open to as many people as possible. Just to get that education out there. My passion is educating women to empower them to live a longer, healthier life.
Yeah, I love it. Well, when we come back, we're going to take some questions from some of our viewers, some very interesting questions, and see how our panel addresses those. We'll be right back. And welcome back. We are here with a panel of experts on menopause, hormone changes in our lives. We are going to take some questions now from some of our viewers. Catherine writes, I recently found out that shoulder pain was the result of menopause, perimenopause. Are there other random pains that are caused by hormones? She's 44 years old. Interesting. Random pains caused by hormones. It looks like, Melanie, you
definitely caused by the lack of hormones, estrogen being one of them. It actually lubricates our joints. So if you have that joint pain when you're walking or running and you just feel like you can't exercise anymore, it may be a lack of hormones. Testosterone also helps with pain, but we found that in some studies that estrogen actually decreases the pain threshold for a lot of people, so that those people who have chronic back pain or chronic hip pain, by optimizing their hormones, specifically the estrogen, their pain levels went down and they didn't need as many pain pills or didn't need as much ibuprofen throughout the day.
Right. And
another major one is DHEA. DHEA, in many of the studies, it's an anti-inflammatory and the immune system, and it helps with cardiac and all that, but specifically joint pains. And you will see they're using high dose for pain for lupus for patients, and fibromyalgia and all that. So a lot of people, when they start that, they're like, whoa, their joint pains get better. So I think it's important to remember when you optimize hormones, they all work together. Like the girls' club, they all,
Exactly,
you can't leave one out. And you put them all together and you just get like a terrific effect.
And Catherine, I was going to ask you, as far as seniors go, some senior citizens are in pain 24/7.
And so that's why some of our older clients have been benefiting by looking into functional medicine and getting their blood tests done and looking at this. And it's very confusing for seniors because a lot of times their general practitioner or other doctors aren't trained in this, and so they're getting conflicting information. We also have a lot of challenges with seniors that just get mad because this kind of wellness treatment is not covered by their Medicare.
Yes.
And so a big thing that we talk about is that see your insurance doctors for insurance things. Keep all those relationships, but have another doctor on the side that you're working with to optimize your health and just getting second opinions on things. It can make tremendous difference, and it's really not that expensive. And so I tell my mom, this is what you have saved your money for, to invest in your health. Spend it on your dance lessons, spend it on the hormones, spend it on the treatment so that you can hopefully ward off dementia, cancer, and other things. So this is about trying to protect your longevity. And a lot of times people think, well, I don't want to live to be 100 or whatever it is. Well, you might if you feel good.
Yeah,
You
would
it's
be in
about
pain.
feeling good.
But I don't want my body to outlive my brain.
Oh, exactly.
Want to have good quality life.
Yeah. All right, well, our next question comes from Darla. She says, I admit I'm a skeptic to HRT. Growing old is the most natural process in a woman's life, and our bodies are very remarkable. Should we be injecting foreign hormones into our bodies?
First
Dr. Ray.
We should not be injecting foreign. Okay. Again, education is the key. Go see someone who can tell you the difference between bioidentical and synthetic. And bioidentical, you're just putting back what you've lost. I tell people, when your gas gets low, what do you do?
Fill it up.
When the oil gets low, what do you do? Hormones got low, what did you do?
Fill it up. Exactly.
So that's how, it's just the education and understanding. There is a difference between, again, it comes back to the WHI study, and they scared women and even men too. So I would say that the normal aging, not just for women, men too, but you don't have to go that route. You can live your best life,
And if you think about it, we are the only creatures that live postmenopausal, and we're all going to grow old. I just want to grow old gracefully.
Oh, exactly.
Well, and I'm just thinking too that we have such an opportunity, legacy-wise, to give great examples to younger women about how to age well. And I talk to seniors a lot about when you're expecting a baby and you have a young family, you want to be the best parent you possibly can be. So you buy the books, you do the apps, and you do all this study and preparation to be a good parent. And we have the opportunity to be a good parent through our whole entire life to the best of our ability. And I think that being curious and resourceful and asking questions is going to help our daughters.
Oh, absolutely. And when did we learn that, and I know you mentioned that study at the very beginning, but when did we learn that it's okay to use hormone replacement therapy and that it's not going to cause problems? How long has this been?
It's been known for a long time. It's not been accepted. Arlene Evans de Beverly nailed it a long time ago and was criticized and everything else, but she was right.
Yeah.
She was right. It was the rest of us taught the conventional way. Even with NAMs and all them, they're just now coming around. So it's been around. They say there's no studies. There's a lot of studies.
You just have to know how to read it. Because if you don't know what the study is saying and you can't differentiate between the 17-beta estradiol and the equine conjugated estradiol, you're going to read it wrong. And if you don't know the difference between progesterone and progestin, you're going to read it wrong. So it's just having that knowledge to know which one of those is what our body is making and which one of those was a synthetic product placed into these women that causes these bad adverse effects.
One of the studies I think that a lot of the regular docs, providers caught on to is the one that says your baseline estradiol or testosterone is high, then that's a problem. But what it is if you just measure your baseline, but that has nothing with me giving it to you.
Right.
And so we say that association is not causation. You see, so that's how they're interpreting some of those studies. So it is askew.
Oh, so interesting just to talk all about this. I'm so happy you all are here. Well, our next question is a video question. It's from Lisa. She's 48 years old.
Hi, this is Lisa. My question would be about hormone replacement. If there's one that you recommend versus another, if there's a time frame that you think that's best or is best for menopausal individuals to consider thinking about. And then lastly, what kind of questions would we want to ask our provider when it comes time to it? Because sometimes that can be a little, you're not sure what type of questions to ask and how to approach it. So just your thoughts on that.
So that's my girlfriend, and she's doing everything, I would say, to optimize her health in terms of protein, diet, exercise, strength building, lifting weights. And so probably the next step is going to be seeing functional fitness or functional medicine experts that can help make, the next stages better. And I can tell you that, and Lisa's observed this, like I am completely different, the way I walk and the way I move. And yes, strength training helps, but it is the supplements and peptides and hormone therapy that I've been getting. And I mean, it fixed it overnight.
That's what I was going to ask. How long does it take once you start?
Overnight.
Well,
for me.
Yeah, everybody's going to be different. And I
Everybody's
tell people
different.
you have to be patient with the process. Okay, so when you take the hormones, right? They have to do 4 things. They have to bind to the receptor of your cell in order to enter into your cell. Once they're in your cell, they have to be translated, transcribed, told what to do, then they have to go do it. 4 steps for each hormone. I use the lab as a guide because I know what number I'm looking for disease prevention. The hormones getting into your cell is the metabolic effect for you feeling it. A lab doesn't tell me if those 4 steps took place, but you'll tell me.
Oh, because
And so you have to
I'll feel
you'll
better.
feel it. And if
Yeah.
you're not feeling it, that's a resistance. And everybody, I don't know where your resistance, we all have different ones. So you just have to keep
And then you try a different-
You titrate and optimize. You keep going up. If I have a block, why do people have a block when hormones get into the cells? They have endocrine disruptors. They have inflammation. You have a whole bunch of different things that say, no, you know?
Yeah.
So if I'm trying to go through the door to get into the room, but somebody else is pulling it, I can't. That's a resistance. And that same thing happens in your body. So that's what you have to overcome. And that's why everybody's so different. You may start at the same place, but where you end up is going to be so different.
How often do you all do labs then on someone?
It depends on what we're doing, but until we are optimized in a good level and we're not making adjustments, about every 3 to 4 months
okay.
for me.
Same thing.
If we do a pellet procedure, then we are rechecking labs 5 weeks after, just checking to make sure that we got a good rise out of what we did for pellets. And I think one of our questions was how would you take these hormones? There's several different modalities of taking the hormones, and each plan is individualized for the patient, what they prefer, and then what we think would help them the best, because maybe they don't need a very high dose, maybe they just need low. Maybe we want to start low and slowly ramp it up depending on where your levels are, because we don't want to give you a high dose right away, because then that's more likely for side effects. So we want to slowly start low, which is why Dr. Rogers says it takes a while to get you to where you're feeling good for some people, because you've been so deficient for so long. But there's patches, there's creams, there's pills, there's troches which dissolve in your mouth. There's pellets that we do, which is a little surgical incision, goes in the fat of your tush there and dissolves over a period of time. So there's all different kinds of treatment options out there, and you just need to talk to your provider and what they offer and what is right for you.
And I think too, she asked, well, how do you approach your provider?
You just simply ask them, say, hey, first
you
of all,
test my
you're 30
hormone?
years old, 40 years old. I've been reading some things. You have to interview your practitioners. This day and age of the doctor tells me what to do and I do it and ask no questions, that's over. There's too much information out here to be had. So you have to interview your doctors or your providers just as well.
That's
and
great
if
advice.
they don't believe in it, I always felt like a provider's role is I don't have to be the expert on everything, okay? But if my patient is asking me that, I need to be able to tell them where to go to get it. That may not be my cup of tea.
Yeah.
But I need to have the resources to know where to send them. That's what makes you a good provider.
Well, and I think
Definitely.
you're so right. Today it's so different now because, you have to advocate for yourself. If you don't think the doctor's doing something right, read up on it and
Exactly.
show them the study or
Studies,
show
yeah.
them the information that you found out. Because I've heard from a lot of people who've actually saved a life because the doctor wasn't following, the doctor thought he or she was doing the right thing, but
they
once
really weren't, yeah.
the patient came to him and said, wait a minute. So I think that's great advice. Interview your own
And it's never
doctor.
too late to start hormones. So with the synthetic hormones, those studies after 62 or 63 and all that, yes, because they're so thrombogenic building up, meaning clots. But bioidentical, there's no age that's not safe.
Do they still give synthetic hormones?
Some people do.
Mm-hmm.
Oh, they do, even though they can
Some people
cause-
take the horse's urine.
Oh my goodness. How do you know whether it's the horse's urine or if
It's conjugated as equine or primarin. That's synthetic.
So you look at the ingredients on the medicine?
No, the name. I mean,
name. Oh,
the name.
Yeah.
So compounded hormones, it's the biochemical structure, and it really is there's a baseline structure. They are from plants, wild yam and soy and beets and all that, but there is a baseline plant sterol structure that the compounding pharmacies use because it's just like our backbone structure, and they're able to add on the different components that are still bioidentical, as opposed to if you take the structure and you add on synthetic pieces so that now Big Pharma can patent it. See, that's where all your side effects come. So they're not created equal, and maybe go talk to a provider and ask them the difference between the two. So if you get someone that tells you there's no difference, you're over 65, you need to be off of them, then you probably need to be going out the door. So
Because you can continue to take them after 65.
Oh,
and
definitely.
you should.
Definitely
if you want
should.
to live, how do you want to live the last 10 years of your life? You want
Healthy,
to live with vitality,
feeling good.
or do you want to
Yes.
live it with
Exactly.
That's-
All bent over.
Yeah.
Exactly.
Yeah.
All right. Well, we have another question. This is a video question. This one's from Lisa, and she's 60 years old. Listen in.
What is the best way to filter misinformation about hormone replacement therapy? And what is the most efficient way to get fact-based information about ways to ease and even sometimes eliminate symptoms of menopause?
Very good question. And we kind of touched on that just a minute
Yeah.
ago.
I think
But
you identify the experts in your area.
Yeah.
Yeah.
And there's so much misinformation out there.
That's a
So
lot.
it's hard to, discern whether or not this is true or not, So you need to talk to people, and when you find someone that's genuine and you match with them, because like she said, you should interview your providers, because, we might not all get along for everybody, but, and do your own research, be your own advocate. And if we're treating you and you feel like something's not working out, you need to tell us, because there might be something, we're missing, oh, hey, let's check your labs early. Maybe we didn't get this level where we needed to be. Maybe there's something else going on that we need to investigate a little bit further. So, always be your own advocate for you and your body. You know your body better than anybody.
should you always go to a functional medicine doctor rather than your OB?
Well, it depends on, what are you looking for? You have some OBGYNs who understand bioidentical to a certain level, and you have a lot of them that have no clue, and they think hogwash. It's hard because you get these clients, and they're getting one thing from this person, one thing from another. They say, oh, get off that, that's junk. And they don't know. They don't know. It's like,
Did you try other things, Catherine?
I
before?
really just was dealing with hot flashes, and I really didn't know what to do, didn't really ask. I think I had a little bit of fear too. And I felt like what I thought were menopause symptoms were manageable, but I didn't realize that the inflammation and other things I was dealing with that's what you fixed overnight. Now for weight loss and some of that, it took a little while to kick in. But I think being curious is the most important thing. Being curious and just exploring this the best you can. And we're not saying get rid of your current doctors. We're just saying maybe
Expand.
be curious, expand, and like you said, be your own advocate. And you've got to be an advocate for your kids of all ages and your parents too.
I think the other thing too is, like I tell people, some people don't know what's the difference between functional medicine and all that.
Yes,
And,
that's a good
To
question,
me, conventional medicine tells you what. I say come to us because we're going to tell you why. So I tell people, find your why.
That's one thing that I feel like I've done over the last few years is I want to know why is my cholesterol high all of a sudden? work out, I eat healthy, all of a sudden I have high cholesterol, and they say, oh, just take this pill, that will take care of it. But I want to know why. Why is it? Well, it's probably, from your parents, or, from something that you're doing.
Yeah. And what we don't ask is, what's the side effects of that pill?
Right.
So a lot of the high cholesterol medications actually cause insulin resistance, which leads to diabetes, which we could have fixed it if we would have fixed our hormones.
Right.
So instead of doing something more natural, we're putting synthetic products in our bodies that are causing harm to us long term. And why are we doing that? And because we don't tell people what the long-term side effects of these can be. My favorite patients are the ones that come in and say, well, my doctor checked my labs and they're all normal. And I'm like, well, what's normal? Normal range on your labs is based upon the area that you live in. So if you go to Walmart and you look around, what do you see? Overweight, unhealthy people. You don't see normal. I don't want to be normal. I want to be optimal. I want to be at the same level as those people that are running marathons, that are feeling great, that their bodies look good, they're sharp, they can learn, and I don't want to be like those other people. So optimization and normal are two totally different things. So going to a provider that wants to work on your optimization is going to be the best for you in the long term, because we're going to be looking at prevention, not fixing the problem at hand, not just slapping a Band-Aid on something. Why is it causing this? Let's fix what's causing this problem, instead of, well, here's the pill that's going to fix the problem, or slow it down.
Like you said, the statins, I mean, again, those collateral damage,
Well, what about the
20%? If you're not the 20% that get diabetes, you are the 80% that's insulin resistant. They all can't get rid of this dyslipidemia, And what people don't tell people on statins, there's a 33% increased chance of breast cancer. They don't tell them that.
Interesting, yeah. What about the drugs for reflux? Pantoprazole, omeprazole.
That's one of the worst things you can do. See, because you have to understand, why do you have the reflux? You don't have too much acid. You don't have enough acid. So does that mean you just stop the drug? No, you're going to have to wean them off. So gut health, GI health is a whole ball game.
Whole nother thing.
And those drugs tend to increase your chances for diabetes, insulin resistance, and even some renal cancers and all that. It's the total opposite. Everybody just take this pill, I have too much acid. No, it's so much more going on in that. So the gut is huge.
Definitely.
That's definitely something.
That's probably the biggest takeaway, is looking for a holistic approach. And so being really curious on medicine and physicality. And I love that athletes have helped create all this research too, and so that we all can benefit from that. But also just thinking about your home environment, decluttering, downsizing, simplifying your life, making sure you're doing everything to have good sleep hygiene, and everything you possibly can do to reduce stress. These things all work together.
All right, well, we have one more video question. This one comes from Kayleen. She's 40 years old.
Hi, I have a question about menopause. So I feel like menopause gets a really bad rap, but I hear so many people who have gone through it and actually not had terrible side effects and symptoms. What advice would you give for somebody in perimenopause or already in menopause to make it the easiest process to go through?
Get on hormones.
Basically, it's not just the symptoms, it's the disease prevention and healthy aging. So there's other things that are occurring without hormones. So I tell people, don't be afraid of hormones, be afraid not to have hormones. So there's other things going on that it's going to come out later on.
Yeah, so when you stop, for instance, when you're in perimenopause, you'll go like 3 months without a period, and then you're back on track. And then you may have a hot flash here or there. I remember I had them for maybe 2 years, and all of a sudden, oh, they're gone. Okay, I made it through. Nope, because they came back with a vengeance. So,
it's the progesterone deficiency when you're perimenopausal, and you will convert your progesterone over to the amount of estradiol you need. So you don't give somebody perimenopausal estradiol, because you get 5 Bs. You get the bitchy, bloating. That's how you can tell. So they'll make their own estradiol from their conversion of progesterone. So once they're no longer making it, that's different. You can tell when they transition because they'll have these other symptoms. They can, man, look at my belly, the other things kick in. So it's just a matter of being in tune with your body and having education and knowledge.
Yeah.
See, knowledge is one thing, but knowledge plus action is power.
I love it. One other question, and you touched a little bit on it, Katherine, was the cost. Let's talk about the cost, because I think, insurance isn't going to cover it. So what does it cost to see you? I know, Dr. Rogers, there's no cost for a consultation, but after that, what are we talking about?
Well, and first of all, I would say, what is the cost of dementia? What's the cost emotionally and financially? What is the cost of these diseases that the root cause is inflammation? What is the cost there? So there's a cost for not treating, first of all. And so it's get curious.
Those facilities are what, $12,000, $15,000 a month?
Yes, yes, they are.
Yeah. How much is your health worth to you? I do free consultations as well. I charge $200 for labs, then we sit down and go over it, and then I have different options depending on how we're treating you for the cost of the medication, and we go over that in depth in the office. So everybody's program is different.
Yeah.
Does insurance cover the hormones themselves? Because I know, for instance, when my OBGYN, she put me on a patch and then I take a progesterone. And that's covered 100% by my insurance.
If it's something that we can send to a pharmacy, yes.
Okay.
Yeah, if it's compounded, a lot of times they change their rules and all that. And sometimes you can kind of do a hybrid mix. We just want to make sure you're getting the correct compound.
Right, that's the most important
So that's
thing.
really that. A lot of the compounding pharmacies, they won't even take insurance. They'll give you the stuff so you can send in and all that. But so it just depends. I mean, we do for the hormones. I have a management program where I'm managing you, so I'm getting paid for that. You pay for your labs and your meds. Your labs can go through insurance and that, and some of the meds, depending on where we're getting them from and all that as well. So it's just a management for the year, and overseeing everything and looking at body composition and everything else. So outside of that, when you need additional things, so we have a comprehensive gut health program. We can look at everything in your stool and tell you what's going on. And then if we're looking at cognition, mental decline, reversal of chronic diseases, autoimmune, reversals through an integrative approach, that's mainly a la carte. So it just depends on what that patient is looking for.
I love it. All right, we'll be right back. And as we wrap up our special, looking ahead to the future, what changes and advancements do y'all hope will come out of this in the future with hormone replacement?
I hope women are able to talk more openly about it and not feel ashamed that they're going through this, and be able to do research and speak up to their provider and get the help that they deserve.
Awareness.
Yeah, and more studies.
Well, my children are in their early to late 30s, and they see the changes, they see the benefits, and so they're already looking at hormone replacement therapy for themselves and how to optimize. And then the other thing is protein, strength training, exercise is so important, and these are the things that are going to keep you younger. Yeah.
Yeah,
That's it. It's the entire body, and has those different variables. You have to hit them all.
Yeah. All right, ladies, thank you so much for being here today. It's been so informative and just a lot of good information for everyone out there. So thank you, and I hope everybody will talk about it now over dinner or whatever, or over Pilates. That's going to do it for us. Thanks so much for watching and being here and help with changing our conversation. Have a great day.